Ladies and gentlemen, does this picture look familiar to you? This is the picture of a government, typically a developing country government, such as Bangladesh, where civil servants are ruled by command and control that's been set often by colonial times. They have no autonomy to make changes even if they want to, and risk-taking is extremely discouraged. So what results is a government that is stuck in the past, not being responsive to the citizens' needs, and a civil service that checks boxes and not follow what the citizens are really requiring. About 10 years ago, in the Prime Minister's Office of Bangladesh, a program called Access to Information, or A2I, was set up to exactly disrupt this civil service mindset. A2I introduced empathy training. This training brings in about 30 civil servants at a time, where they go through a 5-day immersion course, and civil servants from hospitals, so doctors, teachers, policemen, administrators, they all come together and visit each other's offices. And they have to pose as citizens, which they are. A doctor goes to a school, a teacher goes to a land office, a land officer goes to a hospital, and they're mere citizens. So they don't have the privileges of being a civil servant, and they don't know the system very well, because they're going to a different office. And they have to sort of go through the motion of what a citizen actually faces, all the hassles and everything. They bring back scathing criticisms. The doctor criticizes the school, the teacher criticizes the land office, the land officer criticizes the hospital. And at the end of the day, there is this list of criticisms that they actually have to go through. The following day, the doctor goes back to the hospital, and because he has developed a critical eye the day before, he or she is able to understand what citizens face in a hospital. And that's the whole principle of empathy training. They take the last 2 days of the week to develop an intervention. When they go back to their own workplaces, they have to implement that intervention. In the last 5 years, about 5,000 civil servants have gone through this course, and about 1,200 pilots have emerged. 20 of them have been scaled up countrywide. One example is this doctor who went through this course and went back to his hospital and found that about 2,000 of his poorest patients don't come to his hospital because they get pushed around, they don't wear the right clothes to actually even enter the hospital. So what he did was develop a database of these 2,000 families, and he gave them VIP cards. These are just paper cards. When the patients come to his hospital, the government hospital, they are taken to a VIP line. So they are treated first and foremost before any other patients are treated. So these poorest patients become his VIP patients. And he's also waived any diagnostic fees for all of them. So essentially he's violated 2 rules of the government. One is that everybody goes to the same line. He's created a VIP line for them. And people have to pay for diagnostics even if they're poor. And he's waived fees for them. So instead of getting penalized for taking this risk, the ministry has taken notice, and they're actually trying to replicate this across the whole country in 500 different locations. And this may become the basis for universal healthcare in Bangladesh. The next story, A2I introduced an innovation fund which encourages civil servants to break out of the box and think anew to solve problems. This is an agriculture extension officer who's found that when farmers bring explanation of crop diseases, they often don't bring the diseased crop or the pest. They just come with a description. So what he developed was a series of pictures of stages of crop diseases or any pests that affect the crops, and he shows these pictures to the farmers for better and more accurate diagnosis. And he's also figured out that the junior officers in his constituency are able to develop better diagnosis for the crops just by looking at these pictures and along with the farmers. So this system again was developed with the innovation fund that A2I provided, and again the Minister of Agriculture took notice, and this is being replicated across hundreds of locations across the country. In the last 5 years since this fund was launched, about 4,000 applications came from all over the country, mostly from civil service and also from private sector, and about 200 such awards were given. And this fund has created a new kind of mindset within the civil service. Third story is about a district administrator who noticed that citizens come from faraway villages, 40-50 kilometers away, multiple times to collect certified copy of land records, which is often a case of life and death for them because they own very little land, and getting a certified copy is very important for them. What he decided was that if this service could be digitized and decentralized to a nearby location, which is within walking distance of the citizens, then that would make a big difference in their lives. So he chose a local government institution within that vicinity of where the citizens live, and developed a very unique form of public-private partnership, where the hosting of the center is done in a government office, but the service is dispensed by a local entrepreneur. So this is a very unique public-private partnership at the local level, where the government hosts the service, but the service is dispensed by a local entrepreneur, thereby focusing on excellence. And in the last 8 years since this center was created, this public-private partnership-based one-stop shop was created, over 100 type of services, many of them from the private sector, such as banking, e-commerce, have been introduced. From the public sector, we have introduced passports, land records, exam results, and many other types of services. Every month, about 5 million people, on an average, come to these centers, 5,000 of them across the whole country. So this is an example of where a local administrator noticed the citizens' problems, took the matter in his own hands, developed a solution, developed cooperation with the private sector, and took it countrywide. Fourth story, this is from the education sector. 23 teachers about 7 years ago told us that the way we were introducing technology in schools was completely wrong. What they focused was, the first focus they told us should be really on teacher training. We have about 950,000 teachers in the country and about 70 plus teacher training institutes. So you can do the math and you can actually see for yourself how many years it would take to train the same teacher to bring them in a refresher training. It usually is 10 to 15 years per teacher, which basically means that curriculum changes and the teachers don't get trained. So these 23 teachers told us that what they needed was really a social media platform where they can teach each other. So the more prepared teachers teach the less prepared teachers across the country. So in the last 7 years, we have seen about 323,000 teachers flock to this platform, and about 143,000 content for education have been created by these same teachers. So this is an example where teachers took the problems they were facing in their own hands, suggested a solution, worked with A2I technology team, and developed a countrywide social media platform to solve their own problem. The fifth and the final story is about another district administrator who became a catalyst for citizens' action. Typically this role is reserved for NGOs. Government doesn't get into citizens' action because government and citizens are often at odds with each other. A college student posted about a canal called Jail Khal, about 3 kilometers long, saying that her grandmother and her mother used to be able to use that canal for fetching water and bathing in the canal. And since then, it's actually been completely dumped with sewage and all kinds of garbage. So the canal, the water cannot even be seen. So she asked the question, can we come together to clean this up? So this was posted on the district administrator's Facebook page. And within hours, there were hundreds of comments, thousands of likes. And the district administrator saw that this was his opportunity to become a local hero by taking matters into own hands. So he mobilized private sector funding for logistics, and about 40,000 people gathered to clean up that canal. So this was one story there, but this was not the end of it. Another district administrator took notice of this, and another posting happened there by a citizen, and he took that opportunity to start cleaning up a 23 kilometer long river. This was a much more ambitious project. So about 200,000 people gathered there to clean up this river. And that was not enough because it was a long river and people's action was not enough. So the government came forward and allotted a $40 million project, $40 million dredging project to clean up that river. So people's action, again facilitated by civil servants, can actually create massive collective action and massive positive results in society. The mantra in Bangladesh civil service became reducing TCV, time, cost and the number of visits for citizens, for every single service. We did a measurement in 2017 for about 90 different services of how TCV was reduced by digitizing and decentralizing service delivery. And we saw that about 1.2 billion person days were saved, about $2.9 billion were saved, and 471 million visits did not take place for citizens because the intense focus for reducing TCV by civil service. What we're really talking about is disrupting the civil service mindset to create the concept of govpreneurship. And govpreneurship is really the nurturing of entrepreneurship within the government. It has 4 components that we have seen. Creating a sense of purpose. In our case, TCV is really the sense of purpose that the civil service has. Creating a culture of autonomy where civil servants can actually take matters in their own hands and make decisions. They have that independence for that. The innovation fund that I talked about provides that kind of autonomy. The license to fail that we provide from the Prime Minister's office provides that autonomy. The third is creating competence. The empathy training that I talked about creates that sense of competence and understanding, realization for what citizens go through, the hassle they go through when they have to access a service. And the last and the fourth bit is cooperation. Cooperation across agencies and cooperation between the public sector and the private sector. So these 4 different things, purpose, autonomy, competence and cooperation, create the form of govpreneurship that we've been able to nurture in the Bangladesh civil service. What we have seen really is creating that culture of innovation, is that innovation is a bottom-up process. It really needs to start by understanding the pains of the citizens, going to that empathy, but to scale up that innovation really requires policy intervention from the top down. So the combination of the bottom-up understanding, a prototype, and top-down scaling up through policy making is really what the govpreneurs do the best. And we are on a journey to create thousands of govpreneurs in Bangladesh civil service, and many countries are taking note and they're replicating this model. Thank you.